Throughout history, medical practices have often taken strange and unconventional turns in the pursuit of saving lives and treating ailments. One such peculiar method that emerged in the late 1700s was the use of tobacco smoke enemas. While today the phrase blowing smoke up your arse is used metaphorically, it originally had a literal meaning, referring to a medical procedure that involved blowing tobacco smoke into a person's rectum. This article delves into the fascinating history of this practice, exploring its origins, widespread usage, and eventual decline. The roots of tobacco smoke enemas can be traced back to Native American cultures, where tobacco was known for its medicinal properties. European doctors soon learned of these practices and began advocating for the use of tobacco in various medical treatments. In 1745, the renowned physician Richard Mead was among the first to propose the idea of administering tobacco via an enema to resuscitate drowning victims. This marked the beginning of a peculiar medical trend that would gain traction in the following years. By 1774, the practice of tobacco smoke enemas had become more organized and widespread. Doctors William Hawes and Thomas Cogan, practicing medicine in London, established the institution for affording immediate relief to persons apparently dead from drowning, which later evolved into the Royal Humane Society. This institution actively promoted the use of tobacco smoke enemas and even offered monetary rewards to individuals who successfully revived drowning victims using this method. The procedure itself involved inserting a tube connected to a fumigator and bellows into the rectum, through which tobacco smoke was blown. The nicotine present in the tobacco was believed to stimulate the heart, resulting in increased respiration. Furthermore, the warmth of the smoke was thought to help dry out the patient's insides and eliminate excess moisture. While the rectal route was the preferred method, some doctors opted for blowing smoke directly into the nose and mouth. The popularity of tobacco smoke enemas extended beyond resuscitating drowning victims. Physicians of the time believed in the wide-ranging therapeutic effects of tobacco and began using smoke enemas to treat various medical conditions. It was considered a remedy for headaches, hernias, respiratory ailments, abdominal cramps, and more. In desperate times, tobacco enemas were even employed during cholera outbreaks and in the treatment of patients in the final stages of diseases like typhoid fever. As medical knowledge advanced, scientists and researchers began to question the efficacy and safety of tobacco smoke enemas. In 1811, English scientist Ben Brodie conducted experiments on animals and discovered the toxic effects of nicotine on the cardiac system. This revelation sparked a gradual decline in the popularity of tobacco enemas as medical professionals sought more evidence-based and less risky interventions. With the emergence of improved resuscitation techniques and the understanding of nicotine's harmful effects, tobacco smoke enemas faded into obscurity. The practice of blowing smoke up someone's arse, once a real medical procedure, has become a bizarre and captivating historical footnote. The belief in the therapeutic properties of tobacco led to the widespread usage of tobacco smoke enemas, particularly in resuscitating drowning victims. While this unconventional practice eventually fell out of favor as medical science progressed, it serves as a reminder of the strange and often unorthodox methods employed by our ancestors in the pursuit of healing and saving lives. Subscribe and share for more from Interesting AF.